sorry. You called me? Okay, sorry. Okay. Sorry. Thanks, Chairman. Secretary, nice to see you again. Thank you. Thanks for so much in the IRA mattered in people's lives. Just did something in Toledo on a whole other subject that mattered to people there. I want to thank you particularly for your work in prescription drugs. One of the most important things we did, $35 insulin, 72,000 Ohio seniors will benefit, 219,000 Ohioans who rely on ACA will benefit. We want to expand, as I know you do, and Senator Whitehouse and I have worked on this to expand the insulin cap to everyone, not just Medicare beneficiaries. Federal government negotiating better prices for patients. Many years ago, when you and I served in the House together, I used to take buses to Canada, about 3 hours away. People would be able to fill their prescriptions with negotiated price the way our own VA does, saving 50, 60, 70%. We can do that now, and thanks for your work on that. So walk through briefly, because I have another topic I want to talk about, how this will all work, how HHS can work to implement the law to ensure lower prescription drug costs.
So, Senator, it's already in effect, as you mentioned, with insulin. We see how it's working. I've had any number of conversations with a lot of seniors who rely on their Social Security check, essentially, for their day-to-day living. When they hear that $35 is all they'll pay now for their insulin, where before they were paying $100, $150, $250, it's a godsend for them. The fact that today we can yank back the extra profits that a pharmaceutical company is making if they try to raise the price of that drug by more than the rate of inflation, that's a great thing for Americans on Medicare as well. The fact that today the out-of-pocket costs for a senior are now being limited so that even if you have to use that expensive cancer drug, you won't pay more than about $3,500 out of pocket. That's still a lot of money.
And that number comes down.
And next year it comes down to $2,000 total. And for folks who are paying tens of thousands right now, that's real money.
And you think about what this Congress, the last two, have done in terms of restoring, in my state, 100,000 union workers' pensions restored, what the child tax credit did temporarily. We keep moving on it, dropping poverty rates by 40%, and what we're doing in drug prices. I mean, it affects huge, huge numbers of people that need a little bit of help in their lives. Thank you for that. I want to shift to East Palestine. You and I have talked on the phone about it. The site of the train derailment in eastern Ohio, just slightly into western Pennsylvania. Senator Casey belongs to this committee. I made my 9th trip there this week. The administration's announced a few NIH grants to get some work underway on health monitoring. That's a really good first step. I've asked HHS to set up a voluntary disease registry for the residents of that community. And I just wanted you to commit to working with my office and the residents of East Palestine and its surrounding communities, including Senator Casey's impacted constituents, in a voluntary disease registry and additional resources for long-term health monitoring.
Senator, look, I thank you for your leadership on this, on East Palestine. I feel like you're always nipping at my behind on this one and making sure we're doing something. I'm glad we were able to get $250,000 to that local community health center right after the incident occurred to help them out. We're glad we sent CDC out there to do the in-person surveys to help find out what the health status was of people. NIH now this year announced 6 grants that are going out to help understand what's going on there for the folks in East Palestine. And we are absolutely prepared to work with you and state and local partners on this issue on a registry and these other matters.
Thank you. 2 other quick things. I appreciate the commitment you made when we talked during last year's budget hearing to use a project labor agreement during the construction of the new CDC NIOSH facility. NIOSH is an institution, the National Institute of Occupational Safety and Health, unlike any in the world. Cincinnati, Ohio, make a huge difference in workers, studying and understanding workers' illnesses and diseases and injuries, and that matters for, it really is about the dignity of work. Thank you for that, and look forward to working with you to make sure we have the resources to see this project through to completion and get that PLA in as quickly as possible. The other thing is we spoke recently about the financial issues. Salem Regional Medical Center, it happens to be in the same county where East Palestine is. The train going through Salem was actually on fire before it derailed 8 miles later in East Palestine. So that regional medical center faces problems because of an error made by one of Medicare's regional contractors. I need your commitment to continue working with me to ensure that we deliver timely solutions, to ensure that we can keep providing care through the Salem Regional Center, if you would.
We're prepared to continue to work with you, Senator.
Good. Thank you, Secretary.